What? Look here. This is here must be the ilio-hypogastric and ilio-inguinal. These two nerves originate sometimes together like this and separately only here. It's visible like the separate here. Only the fascia, you see, covered. So here you have the two completely different components. You see here. And this nerves ilio-hypogastric. So when I mark like this, here the superior component of this nerve is the ilio-hypogastric. The inferior component is the ilio-inguinal. Exactly. And these two nerves goes between which muscle? Between the transversalis and two obliques muscle. Here you see the fibers of the nerves. So the nerve innervate which muscle? Anterior muscle of the abdominal wall. Yes? So this is the ilio-hypogastric, ilio-inguinal nerve. Ilio-inguinal nerve is continued by a crest, iliac crest here. And is open, is pierced. This nerve pierced which structure? What do you think? The here inguinal canal. Yes, we have the inguinal canal, two rings of the inguinal rings, the deep and the superficial, and exactly the ilio-inguinal nerves. This one pierced in the lateral wall of the inguinal canal like this, and is continued and goes from a pudendus or the scrotum and innervate the skin. Yes, so this is this nerves. And here you see which nerve is visible now. This is it. From which muscle goes? From a to psoas muscle. So which nerve? The genitofemoral nerves. This is the genitofemoral nerve, and sometimes it's visible the nerves here and here, but now from this specimen, sorry, we do not see the lateral. Maybe here, yes, I show you here. Look, so this is the same from this specimen. Maybe we use this during the practical test. Okay, thank you. Now you see here. Oh yeah, it's visible. This one. Here is. This is like the duplicate. You see? So this is the subcostal nerve. This is the ilio-hypogastric, ilio-inguinal goes together here. You see? Here and join. Now it's visible, like separate. So always the superior one, ilio-hypogastric, ilio-inguinal. And exactly here you see which nerve goes from a superior anterior iliac spine.
Genitofemoral.
No, the lateral cutaneous of thigh nerve. Exactly. Perforate here the fascia like this and innervate the part of the skin. Yes, lateral part. So this is the lateral cutaneous of thigh, and the genitofemoral is visible here. Yes, subcostal, ilio-hypogastric, ilio-inguinal, lateral cutaneous of thigh, and here genitofemoral. And the two nerves extra here you see and find which nerve?
Obturator.
No, femoral nerve. Yes. So look, what is a question from a written test? Which nerve originate from a lateral wall or lateral aspect of psoas major muscle? You see, it's a question. The first one is subcostal, all the ilio-hypogastric and ilio-inguinal, lateral cutaneous, and femoral nerve. The genitofemoral originate from the anterior aspect of psoas major. Yes. And which nerve originate from a medial wall of psoas major muscle? Here is obturator nerve. Yes. So the obturator is visible here. You see? Now it's visible. This one is a obturator nerve. So I think I write the question. Yes, refer to the position of this nerve and refer to the muscle. It's very important to a surgery of the abdomen. Which nerve originates from which aspect of the psoas major muscle? Which nerve from the lateral, medial, and which nerve goes from anterior structures of the psoas major? Yes? So here you have all the nerves. What do you have from a list? Exactly. Yes? Okay. So I look
Where's the femoral?
femoral, this one, the big one, the biggest one, yes, of the lumbar plexus.
Which one was
Anterior genitofemoral, this one, yes, genitofemoral, and has a duplicate the nerves. So you know the name show you which innervate genital. So the genital branch is a sensory branch only the female, and the motor and sensory fibers of the men, yes, and the femoral. So this means innervate the anterior femoral aspect of the thigh, so the skin one, yes, here. And the rest goes from a canal. Which canal? Here we have inguinal canal, of course. So from an inguinal canal you find two nerves originate from a which plexus? Tak? Tak, ale przyjedzie z tym moim ciałem. No. No ale Marcin przyjechał, wiesz. So all these nerves originate, these two nerves originate from which plexus? Lumbar plexus, yes? And the nerves of the inguinal canal we find apart from the lumbar branch, which nerves?
Genital.
The sympathetic, yes, we have the sympathetic fibers, sympathetic plexus, innervate the testes, yes, from a man. So which nerve we find? The cremasters, but the cremasters is like the muscle, yes, but the testicular plexus originate from a lumbar plexus, and here the part of the celiac plexus. Why the celiac? Because the innervate the artery originate from a aorta, and the artery, testicular artery, is a branch of the abdominal aorta and follow the course of the testis. So here from a man you find the four nerves. Two originate from a lumbar plexus and two like the sympathetic plexus, okay? But we discuss more about the plexus and the inguinal canal during the lower limb and during pelvis tutorials, okay? So here is more visible. No. So this is a psoas muscle. Okay, so maybe time is look what we have.